Okay, so here we are. We're going to be doing part 2 of the PAR writing training. Of course, in part 1, there was a couple sections where we said see attached pages. So this is the part that we're going to be addressing right now. The first part is a lot of information that you're going to just take directly from your assessment if your assessment was done well. So I will send you a copy of this, but basically the most important parts of this section are that you're going to be writing clinical information that is discussing a history of the client or what they're going through. So why they came into care, any past trauma or abuse, what's going on with these are the keywords: intensity, frequency, and duration of the symptoms that the client is experiencing, as well as what are their mental health concerns and how are they affecting the client at home or at school or in the community. So we need to be proving medical necessity for the services that we're going to be providing. And this is the place where you can really elaborate on what the client is experiencing. Also important is for you to write what's been going on in the last 90 days. So this is where you want to write down maybe where the client has been improving or where they've been maybe decreasing or declining with their symptoms. So they do want to see that the services that are being provided are effective, but they also want to see, of course, if you're continuing to request services, why do they still need services? Then this is the other section that we said we were going to attach. What kinds of services are the client, is the client already getting? So individual, family, PSR, BST, are they seeing a doctor, a psychiatrist? That's important to put here because really that medication they're taking can prove that, hey, a doctor even thinks that this client has anxiety or depression. And then you can put down the dosages, and then I put in here, if applicable, that maybe a PAR was denied for services, but it is, now we want more therapy in order to reduce their, symptoms. Also, something else we've been seeing in PARs is that they are wondering why we should have in-home therapy. So these are some things that I'm going to start trying here. It's recommended that they receive in-home therapy due to maybe their age, their diagnosis, maybe their mother doesn't have a driver's license or a vehicle available, or maybe they have a lot of siblings, or they have siblings with particular diagnoses that would make it difficult for them to travel. So whatever you think, why are you doing the in-home therapy? That's what needs to be put in that section. And then if it's true, write down that they have exceeded their 26 allowable therapy sessions per year. That's something that's important. It's also important that the doctor knows that you have already established rapport with this client. So it's not that they're not having progress because you don't know them very well or they don't trust you. If you have established rapport with that client or that family, please make sure that you're writing it there. And then you need to write, not a threat, but put it out there. What's your value that you're going to be giving to this family? Without these services, this is possibly what's going to happen. So some generic ones that we like to write are here, like they would have increasing emotional distress, maladaptive behaviors, an exacerbation of current symptoms. Or what else could happen? Could their trial home placement fail and they might return to foster care? Or if you have a client who has been hospitalized in the past or who, kind of teeters on the edge of needing to be hospitalized, write that. They might say, wow, okay, we want to approve increased therapy or PSR and BST to avoid a hospitalization. And so that's the kind of information that you're going to be including in this first attached page. The second attached page is going to be your treatment plan, which should have already been completed and signed and done. So you would literally just be logging into your treatment plan. Of course, it would have been I think I'll just sign this really quick. Of course, it would have already been signed and completed, and you would literally just, click here and click print and, make it happen. So you're printing those 2 pages, printing this page and printing this page and printing your original PAR that is completed. And I just want to show you like an example of one of the auxiliary pages that I wrote. They don't all have to be this long, but I mean, I guess you just want to be as comprehensive as possible in order to try to get these services approved. Because if we request them and they deny them, there's a couple steps we can go through, but it might be that that client can't receive those services for the next 90 days. Because once it's denied, we can't request it again for 90 days. And so we really need to be pursuing getting this approved, whatever you think they should have. So again, you're putting down information, demographic information, why the client was removed from care, what kinds of mental health things that they are experiencing currently. Now, something that I personally write is about this part right here. This comes exactly from my assessment. All of this information comes from my assessment. Oh geez, my baby's caught in the power cable. Okay. Um, so all that was in my assessment. And then um, what other services the client's receiving. So this particular client is receiving services from other agencies and what they've received in the past. So basically you just want to say like, look, I'm not the only person who thinks that this client or child, needs help. Other people do too, and these are the services they're receiving. And then, yeah, that's basically it. So good luck. Email me, call me, text me if you have any questions. And yeah, all right.